I'd like to introduce our next presenter, Clare Mullen. Clare serves as the Executive Director at the Health Consumers Council in WA. She plays a crucial role in advocating for consumer rights in healthcare. She is very well known for her efforts to ensure consumer voices are heard and acted upon within the healthcare system. Her leadership emphasises the importance of proactive outreach to engage consumers effectively. Clare's approach is characterised by a strong commitment to listen to and act on feedback from health service users, fostering an environment of mutual respect and continuous improvement in healthcare services. Clare this evening will address the crucial question, what do consumers want from a feedback framework? Her insights will focus on the essential elements that make feedback mechanisms successful, emphasising responsiveness and the practical impact on healthcare quality and consumer satisfaction. With that, I welcome Clare. Thanks, Clare.
Thank you, Tina. And thank you to Liz too. I really enjoyed that presentation. It was both very grounding and very inspiring, so thank you. And hello to a few of the other people who are joining today from Western Australia. So yes, as Tina said, my name's Clare Mullen. I'm the Executive Director at Health Consumers Council in Western Australia. I do have some slides, so I will share that now. And hope that I can continue to see you. Yes, there we are. If by chance you're not seeing my slides, if one of the team could, let me know, that would be good.
They're all visible, Clare. Good to go.
Fantastic, thank you. As is often the case, I've got about 4 hours of content that I'm going to try and squeeze into 10 minutes with a Scottish accent. So I do hope, but what I've done is I have organised it so that the key points I hopefully come across. So very briefly, I'm going to touch on Health Consumers Council for people who might not know about us, touch on why feedback matters, and then some important resources. So if you don't listen to anything else or you don't hear anything else, this is the point I really kind of wanted to get across under the heading of what is it that consumers want from a feedback framework. And in absolute extreme summary, consumers want it to be co-designed, they want it to be easy to use, but more than anything else, they want it to result in change, either for themselves or for others who follow them. And I will expand on this a little bit more as we go along. So very briefly about Health Consumers Council, we are the state peak health consumer organisation in Western Australia. We also have a partner organisation, Consumers of Mental Health WA, who are the peak for mental health consumers. We celebrate 30 years this year. And we have just redone our strategic plan, and our main purpose is to amplify and champion the voices of health consumers so that they can drive positive outcomes. And that's a really important part. As I said, this isn't just about being heard, but it's also about making change. But before I get into a little bit more about what the feedback structures are, I guess what's been top of mind for me in the last couple of weeks is, what is health? So what is this business that we are all part of? And for many of us, we kind of are immersed in it as our jobs and our lives. And this is an image from, which I've seen in various places. It's in the West Australian Aboriginal Health and Wellbeing Strategy. It's the Dance of Life, which is an image by Helen Milroy. I've included a link there where you can access more information on it. But the reason I wanted to draw attention to it is that I think when we think about a Western healthcare system, we do okay on physical health and okay on mental health, noting that for some people we don't do okay at all. But we don't really make an awful lot of space for any of the other aspects, which, while these are billed as the pillars of Indigenous concepts of health, I very much see what I want from my health reflected in these models. So, people, in addition to physical and psychological health, there's also our social health, the health of our relationships, the health of our community. There's the cultural aspects of our lives, which for many of us is a rich part of our experience, and the spiritual aspects. And I want to acknowledge that I'm joining today from Wajak Noongar Buja. It's been a real privilege to me to find myself on this part of the planet that has such a strong and enduring connection to land and country, and has given me an avenue for me to explore some of these other aspects of my health. So I guess I wanted to put that front of mind when we're thinking about a healthcare feedback system. I guess I'm interested in exploring, building on what Liz was saying about moving from transactional to relational. For me, the relational aspects pick up many of these things. And we often hear the word person-centred healthcare is used a lot. And what I observe is that we're decent enough at person-centred healthcare in that we pay attention to the person in front of us, noting that that is not everybody's experience, but for many people, you get paid attention to there in the moment. But what it's harder for, I think, our westernized medical systems to do is to really acknowledge the whole of a person's life and experience. And that is what I regularly hear from many consumers in various walks of life. So just again, I won't go through every part of this, but this is what we hear that people want from healthcare. They want their rights to be upheld. They want it to be joined up. They want to feel included in that. Again, going back to what Liz said about the relational aspects and the compassion. These days, we're moving much more towards it being digitally enabled, but we also want healthy environments where it's easier to be healthy. And I think many of us would like to be able to take safe, high quality care as a given. But I've shared on the screen, and I won't read every word. I will share the slides afterwards. These are some quotes that we received from consumers in Western Australia when we asked people about what they thought safety and quality was. There's a couple of things there. My auntie's disability meant she couldn't feed herself, and nobody would do it for her. Once my uncle, who was helping her get food, was held up and could only arrive really late, which resulted in her auntie not being fed. When my son transitioned services from paediatric to adult, he did that. He was treated at the paediatric service until he was about 15, 16. But when they transitioned to adult services, it took 2 years to get somebody to listen to the consumer when they kept asking, but who's looking after his heart? Because for that particular condition, paying attention to cardiovascular health was really important. And I guess what I wanted to do in showing this is the reality of some people's experience when, the moment might be, well, please give feedback, but actually people may not have the time or attention to seek out how to give feedback. I also wanted just to bring into our awareness that the world of working with consumers and community members is changing, and it's changing quite quickly. So at the top, we've got our Mental Health Commission's framework for engaging with consumers. And what you can see along the bottom of that is doing to, doing for, doing with, and doing by. And we're seeing a really welcome move to more and more, as exemplified there by Lizzie's, the various experiences that Liz has had of co-production and citizen-led activities. Consumers are increasingly being understood to have a real value as critical friends. And again, as Liz said, people walk with a foot in both camps. Consumer representatives and consumer advocates have a really good understanding of the system and a really good understanding of consumer and community needs and interests. So they act as that kind of, that agent that can move between those two worlds. And I want to recommend this book to anyone who hasn't come across it yet, Rebel Health, a field guide to the patient-led revolution in medical care. We held a book club event with the author just last week, and she really makes a strong case for the importance and power of peer roles in all aspects of health. We do it very well in mental health and alcohol and other drug, but we have a lot to learn in the physical health space and those other aspects of health that I talked about earlier. And I guess, again, I think that it's important to keep these aspects in mind when we think about what a feedback framework could look like. The other thing I want to bring to your attention is that very often I think people do have a role in mind. When I speak to many people, I suspect possibly not the people on the call today, in the health system, I'm sure that people think of consumers in that bottom right-hand quadrant, which is as service users. But we're increasingly seeing consumers on boards, 2 or 3 of our health service boards, we only have 5, have help consumers, people who are grounded in the consumer community as board members. We have people collecting data, collecting feedback from other consumers. We've got people making sense of the data, reviewing complaint letters that are going out from the health service just to make sure that they meet the expectations that a consumer might have. So there are way more roles where consumers themselves can have a role as agents in that feedback system. So to expand a little bit on what I said, so the issue of feedback frameworks being co-designed, the really important thing is capturing what matters. We're seeing a lot more talk at the moment about patient-reported experience measures and patient-reported outcome measures, PREMs and PROMs. Thanks, Keith. But I think that what we're not yet really seeing is patient-designed outcome measures. What we're seeing is often measures which either clinicians or academics have decided are important to be collected, and then that information is gathered from consumers or patients. Whereas I think there's a lot more to be done in the space of co-designing A, the questions to be asked, and B, the process to be used, and also to give people confidence that consumers will also be reviewing the feedback, because as we know, a consumer lens can often be very different from a lens of a staff member. People want to have mechanisms that are easy to use. It's great to be able to say to people, you can jump online, it's anonymous, and if that doesn't work for you, then you can phone. But actually, what we heard when we asked people about how easy it is or otherwise to give feedback or make a complaint, one of the biggest things that people said is, I didn't know I could. Another big thing that people said is, particularly where they've had a less than positive experience, why, if I was treated so poorly by the health service in the first place, why would I have any confidence that they're going to take my complaint seriously? And again, that's one of the reasons that in WA we're such big fans of the Care Opinion platform, because when it's submitted via a public forum like that, then there is at least, if you like, an audit trail that says, I told my story. You can't say you didn't know. It also means that that feedback is available for when, you know, journalists contact us and others about other stories that are happening. We can say to them, look for the good news stories on Care Opinion, and you will also see some of the other pieces of feedback that people are giving. But like I say, overwhelmingly, I've worked in my role at Health Consumers Council for 6 years. I've spoken in that time to hundreds of consumers, many of whom have been involved for decades in this work. And I'd say the biggest thing of all they say is they want to know that their feedback results in change. Ideally, they would like it for themselves, you know, if somebody's in the midst of an incident. So if you think back to that person whose auntie couldn't get their food because no one was available to feed them, that person really would like to know that if they said that to a staff member, that would be fixed. Not that they would have to be talking about it after the event, but rather about saying, oh, you know, I raised it and it got fixed right away. But for also that other people have, very many people do go to the effort of providing feedback because they don't want what happened to them to happen to anyone else. And I have to say that's one of the things that I think is a big conversation to be having in Australia is how do we use these individual stories to really transform the system and the culture that we end up with a different system that I know from my conversations with hundreds of staff that many of them want something quite different than is also possible, for example, as Liz said, within the constraints of activity-based funding, for example. Just some of the things that a consumer needs to invest in if they are trying to give feedback or make a complaint. So they have to have the time. They may have to have the mental energy and the willingness, perhaps, to, if it's a difficult story, to share a difficult story again and risk the impact that that has on their own mental well-being. They may be able to draw, you know, get advice from other consumers who, peers perhaps, who've been through it before. They would need to have internet or data and phone access, which is not a given for very many people in our community. And one of the things they can draw on, obviously, are consumer advocacy organisations. Now, I'm reaching the end. The Care Opinion team will be pleased to know, but I've just got a couple more things. People here, I'm sure, will know about the importance of advocacy. And again, we heard Liz talk about it so very well. But just to recap, advocacy is an action or series of actions that assist individuals or groups to achieve and maintain their rights. And as an advocate, we can walk behind you, beside you, or in front of you, depending on the type and level of support that you as a person seeking advocacy may want. In Western Australia, we are very fortunate to be one of the only state peak health consumer organisations that is actually funded to deliver individual advocacy services. And I have to say, I think that's an outrage. I think this is something that should be available to all consumers across Australia. I think to have a clinical governance system that says having a complaint mechanism is enough, without recognising that to navigate that complaint mechanism, even with the wonderful offering that is Care Opinion, is unrealistic and disempowering. And even in Western Australia, we only have 2.6 FTE for the whole of the state and for every health service except involuntary mental health. There are a number of consumer organisations across the country, but similarly, a lack of funding means that our efforts are constrained. And sometimes I wonder if that is the system working exactly as it's designed to do. Because I do think that with more investment in stronger consumer voices, I work at Health Consumers Council because I know that the next wave of transformation is going to be consumer-led, and a consumer feedback framework is a significant part of that. And so just as a reminder of the main point, co-designed, capturing the information that matters to people, collected and reviewed by peers, that it can be done in the moment so things don't have to become complaints, but also that it is easy to do after the fact, and that people can have confidence that the time invested in sharing their story will result in change. Either if they've had a negative experience, that people will be listening. And again, that's why Care Opinion is so great, because you know that it's getting to senior people, but also that where positive things have happened, that you know that the staff involved may get a small lift from knowing that they've made a difference to somebody's experience. And that's me.
Claire, I cannot tell you how much I sit here cheering when I hear you speak so often, because you're exactly right. A lot of the issues you raise, but also what consumers need, it does need to be made easier to understand the complaints landscape, to know that you can make a complaint, that empowerment, that information. I think there's a lot of space for communication in this area. But as much as anything, yeah, we do need to have that framework to enable this. So I'm so pleased you've come on board, and I appreciate your what you said there. So we don't have questions come through that I have seen, but again, keep posting those comments, because there's certainly conversations happening. And if you'd like to take a moment to speak, please do ask a question as you will.
And great to be followed by another Westerner.
There are no questions, but lots of comments
no problem at all.
For you to have a look at there, Claire. And thank you so much for your enlightening presentation on what consumers want. I think the elements and the different areas that you've covered in your presentation will surely keep in mind as we consult in the last session, and for the working group to also consider as they co-design that new governance framework for consumer relational feedback. And really good that you've highlighted we are seeing glimmerings of co-design or co-creation with consumers, being involved in co-production of PREMs and PROMs, but it's very early stages, very nascent, as you've highlighted. And I'm pleased to say we have had a small experience with having consumers actually involved in reviewing feedback of PREMs and PROMs. So having critical friends groups, a group of consumers serving with the care team to review the consumer feedback report, and using that and being involved in co-designing the continuous quality improvement activities or initiatives. So a little bit of learning, but much work for us to do in that space.
Fantastic. Thanks, Tina.
Thank you.